My name's Lori McKee. I'm the Executive Director for Health and Wellness here at the Aggie Health Wellness Center.
Excellent. So could you tell us a little bit about how contact tracing works at New Mexico State University with COVID-19 and all the steps that are taken by your office?
Sure. So the Aggie Health and Wellness Center is charged with contact tracing for COVID cases on our campus, both faculty, staff, and students. And we have a fully trained team that went through the Johns Hopkins tracing course. So we're really proficient in what we do. What we first start with is the report of the positive COVID case. Normally, those come through the self-report portal and gives us important information about the contact, including their Aggie ID, their name, their phone number, and their email, along with the date that they tested and received their diagnosis. That gives us a lot of information to start off with. So we first start by contacting them. We will then do a very thorough interview with them, asking them questions like, are you vaccinated? Yes or no? If you are vaccinated, what were you vaccinated with? And that's because we are looking for those breakthrough cases. We're seeing cases of unvaccinated individuals, but also people that have been vaccinated. We then move on to when was the last time you were on campus and how many face-to-face classes did you have? Were you using your CSPs or your mask-in classes? From there, we will move into the 10 days that you should be isolating for and quarantining for your contact as a positive case. From there, we will ask you your living arrangements. Who do you live with? Do you live on campus or off campus? It's really important to know because most people, when they're in their home residence, do not wear their masks. So being in contact with a direct positive puts those persons as a direct contact to a positive, and they should quarantine and test. So it's really important. If you've been vaccinated and you come in contact with a positive case, the CDC recommends that you don't have to test or quarantine unless you have symptoms. On the other side, if you are unvaccinated and you've been in contact with someone for more than 15 minutes, less than 3 feet apart, with or without your mask, we ask that you quarantine and test. All that information is provided to you by the tracer. If you are not contacted by the tracing team, that means this interview did not detect that you were at risk. If you are sitting in your classes and you are at least 3 feet apart and everyone is wearing their mask, you are not considered a direct contact. That's why it's really important, Aggies, for all of us to mask up every time we are indoors. For more information, I recommend that you send us an email to campus_health@nmsu.edu. Of course, the now.nmsu.edu web page has all the information we have. And as a last resort, the health center main number is 575-646-1512. I highly encourage you to use the email as you will get a written response back from one of the members of the Aggie Health and Wellness Center staff.